Welcome back to another episode of Little Learners on the Go. I am Tanya Lofty, and I'm excited to continue to host this wonderful podcast. I have an amazing guest with me today. Her name is, to me, she's Dr. Gigi, but I will allow her to introduce herself so she can tell us what she does.
Sure. Hi, Tanya. So good to see you. Yes, I am Dr. Virginia Gallup Larsen. My nickname is Gigi. So the children I work with and their families usually call me Dr. Gigi. I'm both a clinical and a school psychologist. So I work full-time in the schools and have for over 20 years. And then I also am part of a group practice and I work with children, teens, and families in a private setting.
Well, thank you for your work. I just want to say that I appreciate it. And today we're going to be talking about advocating for your child's education. Additional services are beneficial. I wanted to present it that way because when you say additional services or they may need some other resources, parents oftentimes, I would say at least 90% of the time, it's this red flag or an alarm that goes off like, what are you saying about me and my child?
Yeah.
Or my child, okay? What we have to do is understand that additional resources are just that. They create a safe space for families and for children. And if and or when they are needed, that's why they're there. I've just seen this through the years, and I do understand those conversations can be hard when you get that call parent that something is going on with my child. And sometimes you may have seen it, often you have, but it's coming to the realization that something is going on that could possibly hurt you or make you feel some kind of way. Now, while we understand that, we still want to make sure that the child's needs and yours are being met, or that we're able to help. And so I really wanted to have Dr. Gigi to talk about this because I understand, and I don't often think that this is just, I've worked with different cultures throughout, and I don't think it's just a cultural thing. I think it's just a human thing.
Mm-hmm.
From a parent's perspective of what's wrong with my child? What are you saying about my literal heartbeat walking around? I'm talking from the parent aspect here. And why are you saying this? What would make you say something like this about my child? So, Dr. Gigi, can you just talk about why additional services are so important to a child's development?
Sure. And I also want to characterize there are kind of two different avenues. There's the medical and clinical that's outside of the school system. And then there are screenings, as well as if a child should qualify, services and resources that may be available. So there are two prongs. The medical is certainly helpful to go to, and we can talk about that. But in terms of what's available through school, so just to give a little bit of history, under the Americans with Disabilities Act, as well as what's called the Individualized IDEA, Individual Disabilities in Education Act. Those were created in order to provide services to children. Under IDEA, all school systems are tasked with what's called child find responsibilities. And so that means if there is a child who is slower in their development in one or more areas, or has a medical or health diagnosis, that there are services available in the schools. So one of the common things we see, we usually want children to begin to have single words around the age of about 12 months. We want them to start toddling and walking around that time. After a child is about 14 or 15 months old, if that's still not happening at that point, or by 2 years, they're really not talking, those are things we become concerned about. And the beautiful thing is that we know that the earlier we intervene with services and supports, the more likely that a child's going to kind of catch up to their peers. And so we're all tasked in the school system for keeping an eye out for kids who might not be meeting those developmental markers in a variety of areas.
Early intervention is key. Early intervention is key. And this is why early childhood is so important, because the sooner we can identify things, the sooner we can address things, and the better off it is for the benefit of the child, right? So yes, and your child may not be premature, but there could be some other things developmentally that are going on or not that need to be addressed. And so parents, I know it may be a hard conversation at times, but do your due diligence, right? And you're there, we want you to be their first advocate, right? You're their first teacher. We want you to be their first advocate as well. And sometimes we don't want to give up the information that is needed for educators to help.
Right.
Now, as a good educator is going to say to you during a parent-teacher conference, or not even, maybe it needs to be addressed well before a parent-teacher conference. Something is going on. What's going on? Help me. That's why we do, home visits. That's why we do. We're asking for information on a form about your child. We're asking because we want to know. We are coming into a situation, and so is your child if they're entering into a child care setting or a school. They're coming in. We're both coming into a situation to merge, to almost have this, to have a partnership. And so we need information. We need the information because we don't know. And we need it not just to pry, but we want to know because we want to know as much. I feel like we're not FBI agents as teachers, but we really have to have these skills as educators to kind of like figure it out, right? We're figuring out your child. Your child is figuring out us as educators and the whole environment. And so we really need to know as much information about your child as possible. Please tell us if your child is premature. Please tell us the information that we need so that we can help your child, right? And I think just knowing that additional services are not it's not a bad thing.
Right.
I mean, if you can get, like you said, and I've seen this quite often, Dr. Gigi, and some things are, you definitely want to look at disparities within different ethnicities as well. But
we're required to by law.
Yeah, for sure. And so if that child is not talking by two, there's something that is going on. Now, I've seen where a child's development, but with additional resources, having your child take speech or speech therapy, that's a good thing.
Right.
That's not bad. Maybe they have not been taught language to that degree, or there hasn't been much communication in the home, or it could be something else, some type of delay. But delays do not mean that your child is not capable of having a wonderful experience.
Right.
I think sometimes parents equate it to, my child will never learn. Let's talk, parents. Something's wrong. They're never going to learn. They're going to be labeled.
I don't want you to label my child.
I don't want you to label my child, right?
Yeah.
And those are all of the I see like stop signs, or like stop, right? Stop can be a defense as well.
Sure.
So it's this defense mechanism sometimes as parents that we put up. And I understand that it could be some relevancy to that, but at the same time, teachers are not good educators. And that's why we also have to go through other people, child find. This is why these resources are here, so
Right.
that you don't have to just rely on what the educator says, because at a certain point we have to stop. We can't diagnose. We may think, but we cannot diagnose, right? We can
Right.
see tendencies, symptoms, but it is not our job to diagnose as educators. So
Right.
let me be clear, parents. Don't allow your teacher just to do that. Keep going with the information to get all of the resources and the tools that you need to get it diagnosed or whatever that may be, so that your child can get the services that they need.
Yeah, and just to clarify too a little bit. So clinically, so my hat as a clinical psychologist, I diagnose. Medical doctors diagnose. In the schools, we identify, and that sounds like a nuance, but it is. It's under the law that we're not diagnosing in an educational system, but we are tasked with seeing if there are children who are not meeting those developmental, academic, or other expectations. The beautiful thing is there's what's called procedural safeguards or parent rights. So none of this can be done without parent consent. And there are several steps along the way where the parents can say yes or no. And even after you say yes, you have the right to go back and say no. You also have the right to advocate for what you think your child needs, because things can't be done without your permission, and you are very much a part of the teams that meet to decide things. But the wonderful thing with children under the age of 5 is that most jurisdictions have what's called a child find office. They may name it something different. Sometimes different states and different jurisdictions within states may name something different. But it's a place where, generally speaking, for most children, we do what's called a screening first, just to see, are we seeing anything that might indicate a delay in their 5 major areas of development. So we're looking for delays in communication. And that may be speech, the way they produce words, or it may be language, the way that they understand and express what they know and what they feel. We look at social, emotional, and behavioral. So are they having more trouble with temper tantrums, regulating their emotions, that sort of thing, than what we would expect for their age? Now, those two things can often go hand in hand. If a child's not able to communicate the emotions they're feeling, it's likely to show up in their behavior. And then sometimes there are underlying reasons where, if there are delays in those areas, plus some other areas, we might look at things like autism, which we know is on the increase. The other areas of development that we look at are motor skills. So they're fine motor skills and they're gross motor. So are they able to run, balance, kick a ball, walk? Are they walking on time? Are they able to, have the manual dexterity to pick up things, like with a pincer grasp, for example? Another area of development we look at is cognition. So oftentimes with these little ones, I'm not able to do formal cognitive or intellectual testing, but we are looking for some specific kinds of skills. And so is your child on track with problem solving? And we're also looking at attention then. We may not diagnose something like ADHD at this age. That doesn't often happen, but we are looking, can they sustain their attention and engagement with things? And can they problem solve? Do they try things out? Are they curious learners? So those are some of the things that we're looking at. But oftentimes the two main areas, at least that I see in my practice, are kiddos that are having trouble with the social, emotional, behavioral part of it, and then the language and communication part of it.
Okay, I appreciate that. And so, can you tell us, should parents be afraid or nervous about this process?
I mean, I think it's natural. I don't know if there's a should. I think it's a natural thing, right? So there are lots of procedures and safeguards that are in place for parents, which can make it feel intimidating. There also sometimes, depending on what the nature of the referral is, there might be a number of professionals who are involved. So there might be a special educator, there might be a psychologist like myself, there might be a speech and language therapist, there might be an occupational therapist or a physical therapist. So when we go in and there are all these people with us, that can be intimidating. And I think it's okay to acknowledge that. I hope teams are caretaking for parents' experiences in terms of this is their first time. And so let's explain and all of that. But do know that I think the thing not to be afraid of is all of those people are there to see if there's a need that the child has, for which they may be eligible for individualized services, accommodations, or other things, so that we can help children achieve those developmental milestones. Like with reading, some children pick it up easily, some need explicit instruction. Emotions are the same way. Language is the same way. Sometimes some expertise and explicit teaching and interventions by a trained professional can help children to catch up and to maximize what they're able to do.
I think that's, thank you. Thank you for just clarifying that and making it, because sometimes, like you said, if you're getting this, often they may get a paper or something and it's like, well, what is this? But just knowing that these professionals are here to assist.
Yeah.
That's why I keep saying additional, they're beneficial. Beneficial means that it's good. It's not bad. It's a good thing to get the services that you need. And I think parents just try to take the stigma off of yourself, or how you may feel, so that you can. And they're really, I love seeing how parents are supported through these processes, because you all, as the professionals, you understand how the parents feel too. And so I think that's a good thing. And it's good to know that these services are here for you. So, you may need to make that call, definitely make that call, at least come in and see what the process, avail yourself to the information to see what that process is going to look like. Because once you start one part of the process, they're going to continue to walk you through the process. So nothing will be, a shock to you in regards to there's no communication.
Yeah. And I think going back, remember that those two avenues, right? One is the medical clinical too. I also think at, well baby checkups and well children checkups, it's good to have those conversations with the pediatrician, because the pediatrician is also tasked with child find responsibilities. And so they're looking for delays in development as well. And get their feedback. Hopefully they're a trusted professional that and you trust. Get their feedback if they think it would be good to refer for what's called early intervention. But they also can refer medically. So there may be speech language therapies, ABA therapies, occupational therapies, and other services that you may be eligible for medically that your insurance may cover. If you have insurance or Medicaid, that those services may be covered too. And there's a two-prong approach. And so sometimes we see families take that medical route first because they're with trusted professionals. Mm-hmm. But listen to those folks. They are very much aware of services that are available through the school system. And would it be beneficial to partner and maybe even have both of those things?
Thank you. Now I have seen through the years, sometimes, where if they go in for a checkup, maybe I can't think of the word. What is your child's doctor may not.
The pediatrician.
Yes, thank you. I'm out of that phase. That's why I was like,
no worries.
But sometimes if the pediatrician doesn't catch it, and maybe the educator, or because when I had my child care program at that time, we were obligated to work with yep. give parents information and resources about child find as well. And also I did screenings and parent teacher conferences then as well, because I wanted parents to know we used it was called, it's a question. It was an ASQ3.
Ages and stages questionnaire.
Yep, the ages
Absolutely.
and stages questionnaire, right? But it
Mhm.
was something for the parents to do, and
Yep.
then we would come together, and we would walk through the each piece of that form, and I would say, okay, if the parent wasn't sure of something, or well, I haven't seen them do this, and I could come in and say, well, I've seen them do this here, or I know we're both agreeing that we have not seen this skill yet, or developmentally something's going on. And then those referrals would come, right? And so just making sure that that's why we're all kind of, you want all these eyes on your child
Mhm.
so that you can see from different lenses what's going on.
Yeah, absolutely. And one thing I want parents to be aware of too is, unfortunately, the law is written such that we're looking for delays and disabilities. So we're looking for what your child isn't yet doing. And so I also want to help just frame that hopefully the teams you're working with, the teachers you're working with, are also talking about what your child is able to do and their strengths. But please know, if those conversations feel like they're focused on what children aren't doing yet, it's because that's the way the law is written and that's the way we access services.
Thank you. Thank you for clarifying. And just, again, we want to, we just, our job, or our position here today is to kind of wave a white flag in a sense of like peace, and let's work together. Like,
Yeah.
hey, let's keep your children. We want your children to, have the services that they need. We're coming in peace, as
Mhm.
in these professions. We're not coming to, we're going to look for delays. That's a part of our job. That's a part of what we do. But when we're bringing it and presenting it, we're bringing it in peace. Trying
Absolutely.
to, trying to.
Absolutely. And I think with an eye to problem solve. So, some
Mhm.
of our teams, like, the teams you and I work on, we try to sometimes put some things in place before we even do those, refer for screenings or recommend that to parents. But again, I can't emphasize enough, there are a number of safeguards and rights that parents have and that children have as a result, where we can't do anything without your collaboration and your consent. So, yeah, if teachers are reaching out, if other professionals in the schools are reaching out, it's in an effort to partner with you and to help make you aware of what might be available for your child.
Awesome. Thank you. So, how can educators assist with providing additional services? Can you just talk, I would like to hear from your perspective and not mine regarding
Sure.
that, and or promote the use of additional services to families. How can we do that?
Yeah, I think one of the things to do is there are a wealth of, one of the things I love about being in the schools and being in education is that we are multidisciplinary, right? We all are trained, we all have specialized training in areas, and while there may be some overlap, we each have our own individual expertises as well. And I think utilizing those consultative pieces. So the speech language therapist, maybe if you notice a child is not yet using their words, what are some strategies and things that I can use in my classroom that can help aid in communication? Inviting them to a parent teacher conference or seeing what recommendations they might have is a helpful thing. Same with the psychologist, the occupational therapist, social worker, counselor. There are a variety, the special educator. There are all sorts of professionals in our buildings and in our districts that can help. Once we reach a place where maybe we suspect that the verbal language in under IDEA is, we suspect a disability. There are 14 categories of eligibility. That's why parents often become concerned about labels. But we must say we suspect a disability in a specific area. Often for our little ones, it's a general category of developmental delays in one of those 5 areas of development. If we suspect that, and that can be anybody, a teacher, an administrator, a pediatrician, a child care provider, a parent, a grandparent, whomever, they may call and make a referral to the Child Find office. and say, I'm worried about these particular things with my child. Most often, not always, but most often a screening will be done. That's a quick assessment, usually between 30 minutes to an hour, depending on what the referral needs are, where professionals will work with children, interview parents or caregivers, get feedback. Sometimes we go observe in the classroom, those kind of things, to get feedback to see if we are also seeing things that we may suspect there may be a developmental delay or another disability that a child might qualify for services. And then from there, those professionals may recommend evaluations. Again, this is that first gate where parents can say yes or no. I give my permission for you to evaluate. If evaluations are done, then the next step is what we call eligibility. That's just a yes or no. Is your child eligible for additional services? Yes or no? And if so, under which one of those 14 categories do they qualify for services? So a team can say, yes, a child does qualify, but again, can't do anything about it unless the parent says, yes, I agree. And then we move forward to create a plan for them if they're eligible. So there are many steps along the way. And the parent is sort of, I don't know, my kids were back in the day with Dora the Explorer was one of their favorites. So we had the troll bridge, right? That, the troll at the bridge that would say stop. Well, that the parents have the ability to say stop. We're not going across this bridge. And then we go across the bridge together if you say yes. But there are a number of stages along the way if we suspect a disability. But that first one is making a call to the Child Find office to say, I suspect that my child might have some delays and I'd like to have a screening.
Okay, and an IEP is an individual education plan, right?
Correct.
Okay,
Correct.
so I think it's good. I mean, I just want to give some language. Of course, you still have to go through these processes.
Right.
It's individualized to your child's
It
education,
is.
their learning.
So if we refer for evaluations and we say, yes, we suspect a disability, that's when that IEP, the individualized education plan or program, comes into play. And it is supposed to be what it is we're looking at based on those evaluations, your feedback, observations, all the information we've gathered. What is a child doing well and where are their needs? And then goals are developed for their needs to try to help them achieve those things. Then based on those goals, services and accommodations are indicated. But again, throughout the whole process, parents have the right to say yes or no. Mm-hmm.
Okay, so I think as an educator, just hearing what you're saying, I think it's important for us to always, even though it's a part of what we do, it is important for us not to let up in regards to educating parents or letting them know what we see.
Mm-hmm.
Not that we don't diagnose or anything. And again, parents can say stop, but just always being cognizant of our role as educators to assist in the process. That doesn't mean we are the end all be all, but we do have a role to play in it. And
Mm-hmm.
so just from the educator's perspective, I guess I'm just want to send a note or kind of talk to educators. Just be mindful, like the work you're doing is very important. The work
Absolutely.
you're doing, I've always, even when I had my childcare in my home, I remember, just making sure I had everything that I needed and that my staff had everything. I always presented it as, because sometimes they'll look at you as a babysitter. And it's like, no, we don't sit on babies. Babysitters, we don't sit on babies. We educate young children. And so in that educating of young children, we want to educate you all as parents as well as to what this can do and how it can empower your child in their education and empower you, right? To know that it's okay if my child needs speech or has a lisp or whatever. I'm just giving a few examples, but it doesn't mean that my child doesn't deserve these IEPs, these additional services, are because your child has a right to learn. Your child has a right to these services. And so I think if we look at it, I just kind of want to help a parent today. If you look at it that way, it's more empowering for you because it's to help you and not to harm you.
Yeah. Absolutely. Absolutely. And it can be hard. I think one thing to acknowledge, so I live it and work it. One of my children, who's now 19, is deaf. And we did not have anyone who was deaf or hard of hearing in my family. So it was a new thing for us to look at too. And I think sometimes you almost feel some grief because, as you said, these are our walking little heartbeats. And so we don't want to hear that they're struggling in some way. And what we know is that children who receive services they may be eligible for earlier tend to do better. Early intervention is key. And so, we might need a moment. We might need to let teams know, teachers know, look, I need a moment to marinate and digest what you've just told me. And we may not hear everything, and that's okay to say. I heard some of what you said to me. Maybe I'm not ready right now, but when you are ready, go back and say, okay, now what is it that I need to do, or who is it that I need to contact? But it's okay to acknowledge, maybe this wasn't the journey we thought we'd be on, but nevertheless, here might be where we find ourselves.
Wow. Thank you so much, Dr. Gigi, for all of your insight and your wisdom in this area, and just, helping parents to, make choices that sometimes aren't easy. And so that's why I wanted to do this, so that you all can know what your rights are and what you have access to. So thank you for joining us.
Thank you for having me.